Good afternoon. About 3 weeks ago, we had what I hoped was going to be the last live briefing of the Metropolitan St. Louis Pandemic Task Force. We said at the time that the pandemic was not over, but that it was entering a new phase. And we were entering a phase where we had more control, and thanks to the proven effectiveness of the vaccines. But we also knew that circumstances could change in this situation. We knew that we could regress and fall back to those difficult days we experienced earlier in the pandemic. We knew that the virus was evolving and producing some variants that would be increasingly difficult to deal with. Today, I'm disappointed to tell you that once again we're losing ground to the virus. For the first time in weeks, the number of people in this region who are hospitalized with COVID is increasing at a rapid pace. The number of people with COVID in the ICU is increasing dramatically. The number of COVID patients on ventilators to help them breathe is increasing, and quite frankly, the number of people protecting themselves and the community by being vaccinated is just not keeping pace with this deadly disease. Now, those facts make a few things very clear. First, as a region, we're moving in the wrong direction again. The virus is winning this round because the highly contagious Delta variant of COVID has established a foothold, and it's spreading rapidly. Next, the virus is gaining ground during the summer, at an exact time that we should be making the most progress against COVID. People can be outside now, more than ever, but still the virus is spreading faster and faster. And those with COVID now are almost exclusively the unvaccinated. Now, for a variety of reasons, too many people have chosen not to get the vaccine. And those decisions are having an impact now. More people are getting sick, even though it's clear that vaccines remain very effective at preventing infection. And it's causing serious illness from the virus. When we should be doing the best, the virus seems to be winning. Now, in a few minutes, I'll walk you through our latest numbers from our region, but first let me share some suggestions on what you and your families should be doing now. Most importantly, get vaccinated as soon as you can. The vast majority of those who are fully vaccinated won't get or spread the virus. Nearly all the people who are fully vaccinated will avoid serious illness and hospitalizations. These are just the facts. Next, continue those techniques that have helped us prevent spread of the virus over the past year. If you're not vaccinated, you need to wear a mask when you're around people outside of your household. If you are vaccinated, wearing a mask is still a good choice because it will help prevent the potential spread of the virus to someone who may not be vaccinated. Also, if you're not vaccinated, you now have even really less room for error. The Delta variant is even more contagious and more virulent than any other variant that we've seen so far. This means if you're unvaccinated and choose not to wear a mask, you're really rolling the dice to becoming sick, ending up in the hospital, possibly ending up in the intensive care unit, or suffering those long-term complications from COVID. Now, wearing a mask, whether you're vaccinated or not, will also help keep the virus from mutating. Every time the virus jumps from one person to another, it has the potential to mutate into something that is harder for our current vaccines to address. Wearing a mask now will play off later for all of those who want businesses to get back to normal. So if you're not vaccinated, also please avoid large gatherings. You're putting yourself at risk while the Delta variant and others are becoming more and more common. Also, keep washing your hands whenever possible, a simple step that has already saved thousands of lives during the pandemic. As Delta and other variants become more common, everything that we can do to slow down this virus is going to help. So let's talk a little bit about where we are today, what our reports are showing, where the vaccinations are, and then where we believe that we're heading according to our modeling. So right now, as you can see on this slide, our admissions are dramatically increasing. Today we're reporting 45 new COVID infections, and the 7-day moving average is up to 33. Now you can see from this graph here, we haven't really been at that moving average for almost a couple of months, and that was when we were on the downward slope. Unfortunately, we're on the upward slope now with admissions. And that translates into our census data as well. So today we're reporting 211 people hospitalized with COVID across task force hospitals, and the moving average has increased to 171. Again, we haven't seen these sorts of numbers for a couple of months, and we're on the upward slope now instead of coming down. A little bit more detail about patients that are currently hospitalized. Again, as we're reporting, 211 patients hospitalized today, 66 patients in our intensive care units, and 38 patients on ventilators. Of our suspected COVID positive patients, we're reporting 26 patients with suspected COVID positive, 5 in our intensive care units, and 2 people on ventilators. A little bit of good news, we discharged 25 patients from our task force hospitals yesterday. That brings our total discharges up to 23,302 patients. Just a little bit about who we're admitting to the hospitals now. So when you look at this slide, you can see the dramatic change that has occurred because of vaccinations of our older patient cohorts. So the data that we have going up until the last week of June shows the increasing number of people that are younger that make up the inpatients for COVID-19. So in looking at this latest data, it's well around 70% of our patients are less than 65 years of age. Now let me correlate that to some of these next slides now. So if we look at where our admissions are coming as well, the vast majority of them are still coming from the metropolitan area. So from St. Louis City, St. Louis County, and our surrounding collar counties. It's only around 14% that are coming from outside the statistical area. So what that tells us is that the sick people are coming from the metropolitan area, not as many are coming from those outlying areas. But as those increase, we know that's going to put more demand on the healthcare services. Unfortunately, we still have people dying from COVID as well. So today we're reporting 2 new deaths. The moving average is 1, but remember, this is a lagging indicator. And so we fully expect this number to increase as we see more patients being admitted to both our hospitals and to our intensive care units. A little bit about our scorecard here. So unfortunately, our numbers are creeping up as well for a percentage of patients with the beds occupied with COVID. So you can see here, it's around 4% of beds occupied with COVID, and around 8.5% of our ICU beds, 8.5% of our ICU beds are occupied by COVID. Now remember, once we get up to that 10% is where we're really in sort of that danger area. And we don't want to go back to that time where we've had 30% of our ICUs occupied by COVID patients. Our new admissions, as I mentioned previously, we're up to 30 now, which is in our yellow area. Once we hit 40, that's when we get into our red. And so it's on that steep increase right now. Our prevalence of reported cases is increasing as well, so we're at 1.2. Remember, this is comparing the immediate 14 days with the previous 14 days. And so this is on the increase. As you get more cases added onto the front end, it's going to be increasing. And then our weekly change is up 37%, which, as you can see, we had not seen until last fall and then our last spring surge. And so this really tells us what we're dealing with right now. And our positivity rate is increasing as well, and we've said before that this is a leading indicator. So around 10% positive, and this is just task force hospitals, so this doesn't include public health data. And lastly, our reproductive number. So remember, in order to interrupt transmission, we have to be below 1. Right now we're sitting around 1.21. As you can see, it's coming down, but still we're significantly above 1, which means we're having active transmission out in the community. So let's switch gears now and talk about, so that's where we are as far as hospitalizations and people that are sick. Now let's talk about what we're doing as far as vaccinations. So we have close to 2 million total doses administered throughout the region. And as you can see here, a little bit over 1 million of first doses and close to 1 million of the 2-dose series completed. And as we look across the metropolitan area about the percentage of people that have been vaccinated, you can see this here. Some counties are doing better than others. This is for total populations that are vaccinated, so not just that 12 and above. This is total population. And so you can see a high of St. Charles there with around 48% of first dose and around 44% of doses completed. All the way down to Lincoln County, which is sitting down in the 20 percentiles. And then over on the Illinois side as well. This is just a graphic representation of what we just talked about. This is limited, though, to the population that's greater than 18 years old. And so on the right side of your screen, you'll see it by zip code, and on the left side, it's by county. And so the important things to point out here is even though we do have a high percentage of people that are vaccinated in the county, there are certain zip codes as well where the population doesn't have high vaccination numbers, and so we really have to be focused on those populations as well as in those outlying communities, such as up in Pike County and out in Washington County, where we really need to get vaccinations boosted up as well. Again, just another representation, but with some numbers now, with how many people have been vaccinated greater than 18 years old by county. And I'm not going to go into a lot of depth on this because I want to talk about some of that here in the next slides. And then this is another slide just showing the total population as well. So this is important because it shows the decrement in vaccine percentages as you go down in age. And so, as you heard me say, most of the people being admitted to the hospital now are less than 65 years old. And so as you can see, once you hit that 65-year threshold, the numbers really start to go down across the board. So when you get to that 45 to 64, the 25 to 44, and then 18 to 24, the numbers continue to go down. And these are exactly the age groups that we need to get vaccinated. So this is one thing that I wanted to point out, and this is the total population by county and age group, and focus on those orange and red numbers. So as you can see, those are the populations that are making up the majority of people that are being admitted right now, and they also have the slower rates of vaccination. They also make up a large percentage of the population out in the community, so around 50%, if not more. Now, this is the percentage then of unvaccinated population overall in by county. And so this is just another graphic representation to show that we still have a significant number of people that need to get vaccinated. So it's not just the percentage, because those percentages turn into numbers. So if we look at St. Louis County alone, even though we're at 46.7% of people vaccinated, and I'm assuming this is total doses or 2-dose series, and the total population, which is why those numbers look different than the 18 and over, that still leaves around 466,000 people that need to be vaccinated. So why is that important? Well, a certain percentage of these people that are unvaccinated are going to get sick enough to have to need treatment in the hospital. And so if a certain percentage of them or a significant number of them require hospitalization, that can easily overwhelm the healthcare systems. So just think about where we were back in the fall when we didn't have a variant that was that transmissible or that was that virulent, and how much how many patients we had to take care of in our hospitals. Now we have a more virulent variant that's more transmissible, but we have a high number of people that are unvaccinated that could potentially turn into patients, and that's what's very concerning. Now, we haven't shown this slide recently, but we are doing some calculations to see if we're at this pace right now with vaccinations, how long is it going to take until we get up to 75%? And right now we're placing it around the end of August and into September if we continue on the current pace that we're on right now. And you can see on the left-hand slide the pace that we're at and how it's been going over time. And so we got to that really high mark up there in March and April. But since then, it's really been declining, and we really need to increase that number of vaccinations again. And then lastly, this is the models that we typically share. Now, we hadn't updated our model for well over a month because we were on a downward trajectory, which is that orange line that you saw there, so a gradual downward slope. The blue line is our new model because we've seen the increase in hospitalizations. And so as you can see, if we're continuing on the pace that we're on right now with the number of hospitalizations and the amount of transmission that's occurring out in the community, we can expect these numbers to increase dramatically as time goes on. And remember, we're operating now off of a lot of challenges with timing. Because in order to be fully protected against the variant, you have to have both of those doses of the mRNA vaccine, so the Pfizer or the Moderna, or at least 2 weeks out from J&J. And so that takes time to build up immunity. And meanwhile, we've still got people getting sick and showing up in the hospitals. So that old adage of when to plant a tree, when's the best time to plant a tree was yesterday, a good time is today. The same holds true for vaccinations. The best time to have been vaccinated was really yesterday or weeks ago, but a good time is today. And so please, we're asking everybody that is eligible to please go out and get vaccinated so that we can slow these curves down. You know, we're tired of taking care of people in hospitals from this disease, and we're tired of having to talk to patients' families about how sick their loved ones are. And so please do this for yourself and for the community. And so I'm going to go ahead and close out my remarks today, and then we'll take some questions from the media. And so I think what we are trying to convey here today is that we're in a very serious spot right now. We're really moving in the wrong direction as far as the pandemic goes. And we have to take steps in order to help us meet this threat from the Delta variant. And we're operating under what's called the tyranny of time because it takes time to build that immunity, and meanwhile people are still getting sick in our hospitals. So this really has to be an all-hands-on-deck approach, and that includes healthcare, public health, government, businesses, churches, schools, and any other group that can help get people vaccinated. The problem right now isn't vaccine availability. We have plenty of vaccine, and we have plenty of people that can deliver vaccine. Right now, we just need to get people's questions answered, whatever concerns they have, but to get as many people vaccinated as we possibly can. Now, hundreds of millions of doses of vaccine have been administered across the country and billions across the world. These are very safe and effective vaccines. The evidence has shown how safe and effective they are. So this is my final plea, my final briefing as I head out of town. So please, everybody that's eligible, again, talk with your loved ones, talk with your healthcare providers, get the evidence that is verifiable, and then please go out and get vaccinated. It's really the only way that we're going to be able to get out of this pandemic. You can't get out of it through masking and social distancing. This is the way to get out. So beginning next week, my colleague and friend, as well as an expert in infectious diseases, Dr. Clay Dunnigan, the Chief Clinical Officer for BJC, is going to start providing these press briefings. I'm going to be deployed, as most people know, with the Army Reserves. Dr. Dunnigan is an amazing physician. He's been my partner throughout this whole thing. He's an incredible leader, and he's going to lead the task force going forward. Now, so with that, we're going to answer some questions from the media. And I'm just going to go ahead and read these off and then answer them. So the first one is, what are your thoughts about the new CDC guidelines that were released today about vaccinated students and teachers not having to wear masks in school and prioritizing in-person learning? So first off, I think everybody agrees that in-person learning is much better than remote learning. And so that's one thing that we did learn from earlier in the pandemic. And so I think that's the right way to go. And then they're also they're expanding out their guidelines that they've expressed earlier, which is people that are vaccinated are protected. And so people that have received vaccine should be able to attend school without masks and social distancing. And this is going to, of course, become more important as we get closer to the school year, as well as seeing how those emergency use authorizations will get expanded to different age groups. And so hopefully we'll be able to expand the number or the age groups of people that are able to get vaccines. Second question, what are your expectations for the next few weeks as case rates and hospitalizations in the St. Louis region? So I believe this is what's going to happen. This sort of fits into my remarks about vaccinations and the time lag. Because we're behind in vaccinations and because we have this variant that's more transmissible and more virulent, we're most likely going to see a continued rise in cases and in hospitalizations. Remember, the curves turn slowly in the pandemic, so we're dealing with patients that were affected 2 weeks ago. Again, this is why the best time to get vaccinated was really weeks ago, but a good time is now. But it takes time to develop that immunity, to slow the spread so that we can bend the curve. And so we're most likely going to see continued rise in cases and continuing rise in hospitalizations. Part of that depends on the community as well. How many people are going to be wearing masks and not gathering in groups and doing social distancing, people that are unvaccinated, that is. And that will help slow the spread as well. But it takes time to turn these curves around. Third question, do you have a sense of where most of the new COVID patient admissions are coming from geographically? And so that previous slide I showed, the majority of them are coming from the metropolitan area. We're not seeing as many coming from, at least being hospitalized, from the outlying area. Now, is that going to change going into the future? Probably so. We'll probably start seeing patients coming in from all of the different regions, much like we saw in the earlier phases of the pandemic. And we'll keep an eye on that, and we'll keep updating our data on that. But the bottom line is people that are not protected or unvaccinated are going to be potential hospital patients. And so wherever you have a percentage of people that are unvaccinated, we're going to see patients from there. We just don't know how many. Question number 4, what is the task force doing to increase the pace of vaccinations? Are hospitals and local public health agencies making any changes to their approach given this increase in spread? So we're trying to get the word out as much as possible, working with our partners. We are going to be ramping up our meetings with our task force partners starting next week so that we can, again, start to collaborate on all of these efforts. But it's really not just dependent upon the healthcare systems and the public health agencies, and I'm trying to make this point clear. It really depends on the entire community. And so if we can get your workers vaccinated, organizations to run vaccination clinics, we can supply the vaccine in the workforce, but we need help with organizing people to get vaccinated. And so this really has to be an entire community approach. You can't just rest on the backs of the healthcare system and public health. And then finally, question number 5, what is your recommendation on masking for people who live in the greater St. Louis region, vaccinated and unvaccinated? So as I mentioned previously, if you're not vaccinated, you need to be wearing a mask. And that's to protect you as well as protect the community. Now there's no harm in wearing a mask if you are vaccinated. So the CDC has said you don't necessarily have to wear a mask. But there's still no harm in wearing one. There is a biological plausibility that somebody that has been vaccinated can still catch the Delta variant and can still spread it. And so for those reasons, that's why the city and the county are recommending still wearing a mask even if you're vaccinated. And there's there's a low barrier effort to prevent spread. And so really anything that we can do to prevent spread is a good thing. But again, highly effective vaccine typically makes that not necessary. And so we do have complete faith in the vaccine, but really looking at just everything that we can do to prevent spread is really the name of the game right now. So that was the end of our questions for this press briefing. I want to thank everybody for paying attention again to this. Next week, we'll be starting up on Thursday with Dr. Dunnigan providing these press briefings, and we'll continue on from there. And we'll ramp them up if we need to and ramp them down when we feel like we don't need to be having these anymore. So thanks everybody for your time, and have a good evening, and let's everybody be safe and get vaccinated.